Mary, you can say the intro if you'd like.
Cool. Okay. So guys, so I am Amira and I'm at Birmingham University, currently in my first year, and Anissa is in BDS 3. So yeah, like she said, we're going to go through a little bit of what life's like at UOB, give you guys a bit of specific insight into the life at Birmingham and also the course structure. So yeah, we'll get straight into it then. So here's information about the interview structure to help you guys feel as prepared as possible. So at Birmingham, you will have four stations, and they usually do split the station in half. So you'll spend around 4 minutes on one half and around 4 minutes on the other half. 4 to 5 minutes, it does depend, and you do get 2 minutes of prep time before your interview actually starts. So you'll be able to sort of read your station and have a think about how you'll answer those questions. So at Birmingham, they usually like their manual dexterity stations. So definitely make sure that you have an idea on that. And they do like to make it dentally relevant as well, their manual dexterity stations. So try if you can, have an idea of different dental tools and things that you might see in a dental practice, just in case they do bring something like that up. And yes, like I said, some years people have had to sort of set up dental equipment and they do sometimes bring out drills and things. So don't be put off if they do bring out something like that. They do like to keep it very dentally relevant for manual dexterity. And yeah, sometimes they'll have stations where you'll have a video to sort of watch beforehand, and then you'll go into the station and they might ask you questions on that video that you've watched. And yeah, they also like role plays. So definitely be prepared for the different types of role plays you have, like your Breaking Bad News, for example. Um, Birmingham is a little bit wacky with their sort of questions. So sometimes they'll have stations that are a bit more you can't really prepare for as well. So for example, they might have like a puzzle task, which obviously you guys can't really prep for. And they're not really looking for you guys to finish it as such. So don't be put off if you don't finish. They're just trying to see how you process that information and how you sort of get through the task as best you can. Um, and yeah, they are also told during that time, for example, the puzzle, to look for signs of stress or anger at the station. So definitely try and keep as calm, relaxed, and composed as you can. Um, and interviewers can be told to act quite mean or straight faced. So again, don't be put off by that. They are told to do that. Lots of things for Birmingham on sort of reflections on work experience and your personal experiences as well. So make sure you guys have all of those up to scratch. Professionalism, a big thing they like to ask as well, Birmingham, as a topic. So again, your GDC principles and things like that, keep those in mind with this interview. And yeah, going back to the manual dexterity task and the puzzle, sometimes it's quite nice to talk through your processing. So that's definitely something you guys can do during your manual dexterity task. You can say, I'm just going to be putting this here, for example, and that's absolutely fine to talk through with the interviewer. Um, but yeah, I'd say Birmingham is quite tough just because it is so hard to prepare for. But if you keep in mind those things I've just said, then hopefully you guys should be okay. And yeah, definitely don't be put off by weird and wacky stations. Okay.
Perfect. Yes, a lot of my friends, everyone after the interview, everyone thought that they'd kind of not done well, but that's the way Birmingham just is structured. Some of the questions are quite tough. Don't worry about it. Most, my friends obviously they got in the end anyway. So yeah, it's a tough interview. Like Amira said, there's a lot of different questions that they ask, from professionalism right through to data interpretation to creativity questions. So it's just about being mentally prepared for perhaps not the most typical interview structure. Like if anyone's applied to, London, like Barts or Kings, they've got quite a set structure. Birmingham's not necessarily like that. They don't necessarily like their rehearsed answers and things. So just some general interview advice. Now Mira's spoken about the interview structure. At Birmingham, really try and build that rapport with your examiner. So they know everybody is going to be quite nervous. try and build that rapport. So have a nice introduction, hi, I'm Anissa, it's nice to meet you. At the end, thank you very much for your time. These little kind of things are things that actually Birmingham do look out for. It's about the kind of big picture, not necessarily just your answers, but how you actually interact with the interviewers, what they take into account. Even little things like Amira was talking about the riddles that are quite challenging for Birmingham sometimes. Little things like sighing or your body language, those are things actually interviewers will note as well. So it's just the big picture just to be aware of. Um, they like their role plays at Birmingham, so make sure you give your good eye contact, fully immerse yourself in the situation. I know you guys have done it in your group sessions. It seems silly, but you have to believe it's real for it to come across as genuine. If they give you their name in the role play, use it. Simple things like that. If you have a wacky question, again, they are literally told to mark you positively. If you say something like, "Oh, that's an interesting question," so just things like that at Birmingham are the things just to keep in mind. Um, I'm sure all of you guys have, Google Doc, or whether you use Anki of questions and bullet points. So make sure you practice with people. I know it doesn't have to be dental or medically related. Just speaking out loud is really important. Or video yourself. Make sure you don't just use kind of the docs or your Anki, whatever it is that you're using for your notes. Speak out loud. Okay. Also, if anyone has any questions, pop up your hand. We'll have a short Q&A as well at the end. Um, Mary, you can see the slides properly, can't you? We're going to talk a little bit about why Birmingham. Obviously, I mean, you guys, I'm sure, have scoured the website as well. Um, but we're going to give you some obviously insider advice being at Birmingham, some of the important things to say. These bullet points are going to be some of the main categories. Now we're going to talk about them in a little bit more detail. Obviously, the first thing you can kind of start off with is if you've visited the city or visited the university, then great. Make sure you say that to the interviewer. It shows that you've had that genuine interest in Birmingham. You've seek to see the city. I appreciate everyone's been able to do that. That's totally fine. But if you have, say something like, when I was looking around each university, Birmingham always stood out for me. Maybe you've grown up in Birmingham, you're and talk about the fact that you like it's an ideal place for you, you love the city, etc. Following from that, it's always nice to talk about teaching styles. So at Birmingham, we have quite a big variety of teaching styles, which kind of suits everybody, every type of learner. So we'll have our lectures where you learn the bulk of your content. So most of your content is delivered via your lectures, which is great because also at the end of lectures, you can always ask questions to your lecturer there and then. And unlike other universities, Birmingham is pretty much all in person. Um, on top of that, we have seminars and small group tutorials. That's the time for you to be able to really sit with your kind of 12 person group and discuss either the lecture you've done previously or a case with one lecturer kind of almost in a smaller group setting. Another thing about the teaching style at Birmingham is when you go on to the clinical years, so kind of after BDS2, so after year two, you also have lab work because we have a working and functioning dental laboratory on site, which is rare, but it's an amazing opportunity to be able to see actually the dental laboratory side of things. The laboratory is basically where you'll make crowns, Bridget, not you, but the dental technician will make crowns and bridges and things. So it's an amazing opportunity to be able to have that on site at the University of Birmingham. Because everyone knows this, right? So everyone talks about the teaching styles, but the thing that you need to say to help you stand out is how that suits you as a learner. Don't just talk about the styles, which, as I said, everyone does. Say something like, I think it really suits me as an independent and motivated learner. But someone who maybe also enjoys working with friends. So you've got this both lecture and that small group situation. And Birmingham allows you to do that. You can always say things like, I appreciate combining lectures where you're presented with the information, the bulk of the information, but then I'd appreciate being able to go through that information in a smaller group setting where I can test myself, where I can see those areas that I need to work and focus more on. And honestly, those small group sessions and discussions really provide that kind of supportive, very much of a learning environment as well, an encouraging learning environment. So make sure you guys talk about that side of things as well. I'll also talk to you. Oh, the next thing is clinical exposure. Okay, so it's not necessarily clear on our website, but basically we have very early clinical exposure. So you're seeing at in some capacity patients from BDS1, which is first year, which is fantastic. So say in your interview answer that that stands out to you that we're introduced from year one to the clinical environment. In first year, you're just observing. You might do very minimal assisting, but you're mainly observing. Second year is when you get to have some phantom head practice. So that's basically the fake sorry, one notification. That's supposed to be the fake heads before you actually go and see your patients. And it's at the end of second year that you get to start seeing your own patient, which is fantastic because you've had nearly 2 years of content and you start being able to see your patients from second year. And to be honest, again, say that excites you. Say the fact that it's offered so early is exciting because it's a practical course at the end of the day, and you can continue to develop your skills, etc. Always link what you talk about back to yourself. That will help you again enhance your answer. If you guys don't already know, we have a pretty newish dental hospital. It's fantastic. It's one of the best dental hospitals from all the ones that I saw. I know Bristol have their new one as well. Birmingham's also very much up there with the dental hospital. We have the dental hospitals on site. So our dental hospital and dental school are both the same building. So you don't have to go on placements because your patients are on site, which is perfect. Um, the Dental Hospital and School of Dentistry, we have a fully computerized phantom head suite. So what that means is, like I said in second year, when you start practicing on the fake heads, we have fantastic facilities to be able to do that. We have separate to that a haptic suite, and what that is it's 3D virtual reality dentistry. So maybe you're a little bit hesitant in your phantom head sessions, and so you can practice on in virtual reality using the phantom head suite, sorry, using the haptic suite. We call it haptic suite, which is the virtual reality suite. Finally, into research, Birmingham's fantastic. We've got access to like world-class research facilities. Say again, link it to yourself. Say something like this really appeals to me as someone interested in research. Maybe you're writing an article at the moment and you're particularly impressed with Birmingham's research and the fact that actually we are a globally well reputed university for research. You can look into if people are interested in research. I think, or cancer treatment at the moment. It's a fantastic opportunity, the research side of things as well. Amira, I'll pass over to you for the clubs.
Yeah, I think it's really nice to be able to talk about clubs or societies that interest you specifically with any of your widest university. It just shows that you're what you personally are looking for in the uni. So, for example, at Birmingham, you can say, there are over 300 societies to choose from, and it's such an amazing opportunity for you to have such a wide range to be able to pick and choose the ones you want to go to. I would say obviously which societies, which clubs you want to join is going to be very personal and up to you. I always say try if you can potentially have like a variety maybe of different ones you want to go for. So, for example, if you have a sports one, that could be really nice just to show you have a little bit of a balance. And if you were to quote that sports society, it just shows that you have, like I say, a bit more of a work-life balance. And definitely, if you could say something like, you'd love to be able to keep up, for example, running, and you'd love to join, for example, Birmingham's athletics club in order to keep that up, especially when, times can get stressful as a dental student. You'll really look forward to having that free time activity to help you sort of de-stress and relax. And yeah, you can go into detail about, why you'd want to specifically go to that society. So have you been doing that sport, for example, from a young age, etc. And yeah, you could talk about maybe joining Bud Society, which is the dental society at Birmingham, and it actually is the oldest dental society in the UK, which is a bit of a fun fact for you guys, you could say. And yeah, I think for the societies and the clubs, it could be quite nice for you guys to say, you'd really love to contribute to sort of the university's community, and the community life within Birmingham. And by participating in, XYZ societies you talked about, you could link that in quite nicely by saying that. And yeah, definitely the campus. I think it's quite nice to maybe mention that if you guys have time. You can talk about how brilliant the campus is, and you could talk about it has a really nice buzz around it. There's so much greenery, so many different food options. There's the new library, which you think is amazing. And you could, again, like Nisa said at the start, if you visited the university, you can bring that in here again, and visiting the university on the open day, you can say all of the students, the staff, they were so friendly and welcoming, and definitely really enticed you to come and study at Birmingham. Um, and finally, I think it'd be nice also to maybe mention the city itself. So not just the campus, but the wider city. So, for example, you could say that, Birmingham's a really ideal place for you to study. You think potentially, the city centre, maybe the atmosphere there was amazing. You have the Bull Ring, your shopping centre, which could be a great place to visit with friends and family. So many different restaurants to choose from across Birmingham. It's a super vibrant city, and it's also really diverse as well, which you could comment on as that being something you're looking forward to. Um, and also another thing about campus you could talk about is the train station that we have here. So it makes everywhere really accessible. So you could maybe mention that too. So yeah, I think that's pretty much our why Birmingham. So can we move on to the next slide? We can maybe go on the life of UAB, unless there's anything you want to add, Bud.
No, I think that's fine. So let's move on to life at UAB. Obviously, everything Amir and I just spoke about for why Birmingham, there's obviously a lot that we just covered. Have maybe a longer answer, but then also a shorter answer. It's more than likely after a couple of minutes, they might cut you off. So there's a lot of detail here. Talk and focus on some of the things we spoke about that particularly stand out to you, and focus on those. Sometimes Birmingham asks this as a question, as a follow-up question. Let's say you finish your station, it might be more of okay, why dentistry, why Birmingham at the end. So just have a shorter answer as well. Don't worry, you don't have to cover everything we just spoke about. That just gives you all the options to everything, all the potential topics you can talk about. Okay.
Yeah.
We can talk
So
about
yeah,
life at
next,
Birmingham in year one.
yeah. So I'll obviously cover first year because I'm currently doing that now. So first year at UOB, it is quite intense, especially the first semester, only because this is the semester where you have three modules, which are quite chunky. There is quite a lot of content to cover, but obviously staying on top of lectures and things really does help. And it is manageable. Everyone does pass, so should be fine. So the first module that you cover in first year is Intro to Cells and Tissues. You also cover CVR, which is cardiovascular respiratory. And finally, you have DRE, which is digestion, renal, and endocrine. So those are the three modules you cover in the first semester. And all three of those, particularly CVR and DRE, they include anatomy practicals. You also have coursework in the first semester, which is why it is quite difficult to manage. So you have two pieces of coursework. One is on ICT, and it includes a mini essay and a case study. And then DRE and CVR sort of merge together, and again, you get a case study on that. But it's quite nice actually having the coursework because for the ICT coursework, it's weighted 50% coursework and 50% exam. So let's say you get 60% or above in that coursework, it means that you only need to get 40% in the actual exam. So you shaking your head?
Perfect. And then second year. Again, split up into Sem 1, Sem 2. So, semester 1, you're going to be covering content such as oral biology, microbiology, immunology, dental public health as well, which is one of the sub modules in semester 1 of year 2. Sometimes where you feel less like of year two is where you feel less like a med student and more like a dental student. So that's when, like I said, you're going to start on the phantom head clinics. You're going to do modules such as dental materials, and also from the end of semester two, you're going to start seeing your own patients, which again is really fun and exciting. Um, Third year then, which is obviously the year that I'm in right now, you start seeing patients so much more. So you're in clinics a lot. It's really fun when you once you get to third year. Not that the previous years aren't, but that's obviously a lot more content heavy. The main module in BDS 3 is human diseases, so pathology, surgery, infection, etc. But one thing that Birmingham's really great at in terms of clinics is we have different specialties. Our clinics are split into different specialties. Some universities just have all of them grouped into one clinical session, whereas we have separate days for different specialties, um, which I think is a really great thing that Birmingham does. And then fourth and fifth year is obviously so far away for you guys, but generally it's more clinics. You're split into a lot more specialties. So you'll have orthodontics, pediatrics with children, which is really fun. And you'll also have modules and content alongside that as well. Um, and throughout all of your BDS years at University of Birmingham, you get assigned a personal academic tutor. It's also something maybe you'd want to add into your interview answer, but it's fantastic because if you have any questions, any concerns, you have someone on hand, a clinical tutor to basically help you. So that personal academic tutor is a really nice thing that Birmingham does. Um, for any questions and concerns. So it's quite a reassuring thing that Birmingham does. Okay.
And yeah, sorry, I only got to talk about the first semester for first year. So I did say so for the first semester, sorry, going back to BDS 1, you have the three modules and your coursework. And then for the second semester, you do craniofacial anatomy. So it's quite a lot more specific for head and neck, which is quite nice. And then you also do a bit of law and ethics, but that was just a bit more information about first year. But yeah, we'll move on to some sample questions for Birmingham now. Okay, so I think we're going to answer these ones. If people want to sort of volunteer to answer these questions, that would be amazing. And then we can give you guys a little bit of feedback. Yeah.
Yeah. So the first question to have a think about, we'll give you guys a couple of minutes to have a think, but it's where do you see yourself in 10 years? There's no right or wrong answer, by the way, you guys. Just have a go. We'll time it for a couple of minutes. I'll give you guys a couple of minutes to have a think, and then whenever anyone's ready, you can just have a go. It doesn't have to be a full answer as well, just even if it's just one or two points. We've had around a minute. I'll give another minute, and then if anyone wants to have a go, then just put up your hand. Okay, that's giving you guys a just under a couple of minutes. Is there anyone brave enough to have a go? Like I said, there's no right or wrong answer. It's just a good opportunity for you guys to be able to practice, and we'll give you guys a bit of feedback. It doesn't have to be a full answer, like we said. Is there anyone brave enough to pop their hand up and have a go? You guys can use a chat function if you want to put in a couple of points that you guys were going to talk about. Because these are the kinds of questions that Birmingham will ask you in the creativity-ish station. So it's good to practice.
Yeah, can I go?
Yes, thank you, Faizan.
Yeah. All right. So so like is it cool if I just give like a bullet point answer or should I give it more structured?
Absolutely, whatever
Yeah.
works best for you.
So I feel like in 10 years' time, of course, that's like anything can happen in 10 years and like anything can change like what my perception will be later on. However, I feel like I'll probably see myself doing specialty training in NHS, maybe in oral surgery as I'm quite interested in that currently. However, this can be subjected to change as I develop through dental school. I also like to see that I'll be more willing to try out new things, new hobbies, possibly new sports. Um, I would like to develop like maybe learn a new instrument, for example. I've been really wanting to like learn how to play piano recently, and I'd like to see myself within these next 10 years just learn a bit more about instruments, maybe the theory aspect and practical aspect as well. I also like to say that I take up new hobbies, maybe just spend more time with family, more time with people, be a bit more laid back, but still try and put in hard work in these 10 years. As in 10 years, you can learn a lot of like new things about yourself. And I feel like the only way you can learn new things about yourself is by trying out new things and developing your own skills. And that I think that's probably what I'd say.
Fantastic. Mira, do you want to go and then add to anything? Thank you very much, Faizan.
Yeah, no, I think I really liked your answer. I think it's nice to you did talk about your specialty potentially being surgery, but that is subject to change. I think that's a really nice thing to say. Definitely be like wanting to specialize in something is really good. But yeah, like you say, looking forward to maybe the opportunity to learning about all of the different specialties in dentistry in greater detail, maybe before you make a final decision, could be something maybe to mention. Maybe even quoting that you're aware that there are 13 in the UK. But yeah, like you could say that oral surgery does really interest you specifically. Maybe would have been nice to say why specifically it does interest you. Just could to make it a little bit more personal to you. And yeah, I mean, after it says, where do you see yourself in 10 years? You could talk about, hopefully being able to have graduated from dental school. Um, and you maybe could say that you're aware that after you graduate, you do have to register with the GDC, so the General Dental Council, and then, undertaking a year of dental foundation training in the NHS. And you could maybe talk a little bit about working within the NHS because they do like the fact that, well, they would like to know that you want to work within the NHS, even if potentially that's not something you potentially want to do. It could be nice to talk about that and the reasons for doing that. So, being able to improve the oral health of the wider community could be good for that. Yeah, anything to add, Anissa?
Yeah, no, so again, Faizan, I think like Amira said, it was a nice answer, I think, because of the fact that you didn't focus just on dentistry. A big thing for Birmingham is they, like I said, they don't like rehearsed answers. I think when you do your intro, they'll probably they'll tell you that. So anything rehearsed, they didn't sing rehearsed, which was good. Um, I had also just noted, I think if anyone says anything about, I'd want to do either like to talk about piano or oral surgery, just make sure everyone like you all explain why. So when you mentioned oral surgeries, maybe explain why. Maybe you've had a personal experience. Maybe you saw it in your work experience and it really stood out to you. For example, for me, and I'm sure half of us here have had braces. If you want to talk about orthodontics, say that personal experience, and your interest peaked when you saw the effort of the dental team, maybe how they all work together to not only improve maybe your function, but also and make you eat more comfortably, but also aesthetically, like mentally, your self-esteem, for example. So that's the orthodontics. But yeah, a little bit on why oral surgery. And again, new hobbies. I know you talked about piano, which was great. If there are any other ones, just being specific, could be nice. Always, whenever, and this applies to everybody, whenever you give a point in a creativity question, link it directly back to yourself and say, something like, I'm really excited to do this, or, this particularly stood out to me because link it always back to yourself and it will help personalize your answer. Um, which can be a good thing.
I think another thing maybe for where you see yourself in 10 years, obviously as hopefully a qualified dentist, maybe talking a little bit about preventative dentistry because that obviously is a really big part at the moment. So, talking about patient education and awareness of that, could be quite nice potentially in this question. And maybe even that link between the fact that you're aware that oral health does link to wider systemic health issues, you could mention too. Um, and yeah, I liked how you talked about the skills. So, like the piano, definitely. If you have a skill that you already have, maybe trying to improve that skill further. Um, and yeah, maybe also seeing yourself in 10 years, you could talk a little bit about research potentially. If there is something in particular that you are interested in, then maybe going into that in a little bit more detail could be really nice. Um, and yeah, I think
Even traveling, even little bits like when it's creativity station. Um, and obviously you can't include all of these. These are just some extra things to say, traveling as well. So anything that you guys are interested in, make sure just to include those in kind of the creativity questions. There's no right or wrong. If you solely just talked about dentistry though, which was you didn't think on, so that was great. Then not at Birmingham they'd want you to talk about something else beyond dentistry. So that's kind of the main point there. Yeah, Mira,
yeah, that's all good.
perfect. The next question we're going to do is a data interpretation. So Birmingham recently have switched into asking some more data interpretation questions. And previously it was more of a focus on things like professionalism, which still does get asked at Birmingham. But we're going to practice a data interpretation question. So hopefully everyone can see the graph okay. Again, I'm going to give you guys a couple of minutes. You can use the chat function. So even if it's just bullet points on, maybe the general things you talk about, and that's fine. Otherwise, I'll give you a couple of minutes just to have a think about some of the things you maybe mentioned. You can always have one person describe, one person explain as well, or you can do all of it. It's totally up to you. Okay, another 30 seconds or so, and then we'll maybe get someone just to describe it first. Data interpretation is becoming a lot more popular as well, not just at Birmingham, but a lot of other universities. So it's a good one to practice. And then we can give a bit of feedback as well. That's been a couple of minutes now. Does anyone want to have a go at just describing the graph? You can explain it as well if you want to, but how would people structure the description? Perfect. Thank you, Zach. Go for it.
Can you hear me properly?
Yeah,
Okay, so the graph is showing the bacteria growth at different temperatures, and on the x-axis it shows the number of hours, and that's going up in increments of 4 hours, up to 24 hours, and on the y-axis it shows the number of bacteria, so in millions of cells per millimeter, and that's going up in 40 in millions, up to 200 million. And the key at the bottom shows the different temperatures and the growth rate of the bacteria. And all of the bacteria at each of the three temperatures, so 37 degrees, 25 and 18, they all peak at the same point, so at 180 million number of bacteria. And what's quite interesting that at the higher temperature, so it is back to zero a lot quicker compared to the 25 and then the 18, which peaks the latest. Do you want me to explain it or just describe it?
yeah, you can do absolutely. You're doing great.
And one potential reason for this is because at higher, so 37 degrees is the optimum temperature for our enzymes in our body. And at at 37 degrees, likely because enzymes are going to be more at that optimum temperature, more likely they're going to be able to, let's say, fight against these bacteria. The immune system is going to work a lot better. And because of that, it means the bacteria will be killed a lot quicker. And that's explaining why the numbers decrease back to zero a lot sooner. Whereas at lower temperatures, the enzymes are further away from that optimum temperature, so the immune system may not be as stimulated and as quick to then just kill these bacteria. So that's just one potential reason for that. So to conclude, this is basically just a graph showing the different bacteria growth at different temperatures, and the one potential reason could be due to the optimum temperature for enzymes in our body.
Fantastic. Thank you very much, Zach. Great. So hopefully everyone saw Zach's structure, which was fantastic. It's perfect. The exact structure you'll need for any data interpretation question you do, whether you're doing it at Bristol, Birmingham, Cardiff, whichever university, you have to make sure you explain the date title first to give a little overall what's the graph showing. As Zach said, it's X and Y axes. Describe them just briefly, no massive detail, but just describe them. And fantastic, you've noticed the key again. Say the key shows X, Y, Z. Make sure you talked about the increments really nicely as well, Zach, and any units if applicable. Then overall trend. So as you talk about basically overall, obviously there's a general increase followed by a plateau followed by the decrease. So that's the general shape of the curves. Zach nicely talked about the peaks and the most important, well, another important point for data interpretation questions is make sure you use the data points. It's really easy to just say, increases and decreases, but if you don't give the data points, Birmingham aren't necessarily you're not standing out. So as that did, for example, talk about the time at which they peak and the level at which they peak. Perfect. If there are any anomalies, which here there aren't, then also you can talk about that as well. Some universities will also give you tabulated data rather than graphs. I think in the past, sometimes it's actually been tabulated data and graphs. So make sure you practice doing both and talking about both. Something that we could note here actually is that obviously this is up to 24 hours, right? But it seems to be that only the growth rate at 37 degrees has fully completed. We don't know what happens for growth rates at 25 degrees and growth rates 18 beyond those 24 hours. It looks like the graphs haven't obviously been able to be completed beyond that. So maybe that could be a point to mention. And actually, we aren't sure about the trends following 24 hours for those other two graphs. Perfect. But that was a nice general description and structure of how to describe the graph. In terms of, and you nicely spoke about the three different ones, faster increase for your 37 compared to 18. In terms of the Y, yeah, you're going to talk about optimum temperatures. You guys, you obviously you guys have done A-level biology. Talking about enzymes is fantastic. Another thing, again, it's only minor, but obviously we're talking about number of bacteria. So maybe how bacteria replicate, i.e., by binary fission. And obviously it seems to be that 37 degrees is an optimum temperature. Sorry, yeah, 37 degrees seems to be optimum temperature for binary fission to take place. So again, throwing a little bit of A-level knowledge in there like that as well can be helpful. Um, the other things is just to note that again, for the 37 degrees, we can see it comes so like straight down to zero. And Zach, you talked nice about either side of the curve, obviously, away from the optimum temperature. Um, the you said, Zach, I think there was some moments you cut out. Um, the reason though that there is a decrease up to zero. So I want to just add why there's the decrease up to like for zero. So if we're going to assume if the other ones project this at the same for the curve for 37 degrees, you can see it around just under it's about 23 hours, the curve reaches zero. Why is that the case? Because nothing to do with then obviously temperature. Why is there a deep decline in the number of bacteria? If that makes sense. Mira, does that make sense? Or if is I don't want to pick on you again, Zach, but if anyone know like why is it gone down to zero?
Sorry, can you hear me?
Yeah, go for it.
Yeah. It might be because of the intraspecific competition between bacteria, which means that there's like a decrease in resources, which makes it kind of less likely for them to reproduce, and maybe the death rate kind of increases, or like it's higher than the reproductive rate, which causes the number of bacteria to decrease as well.
Fantastic. Perfect. So again, it's only a small point, but as Javin correctly talked about, it's getting to zero because they're either running out of nutrients. There's a huge increase maybe in intraspecific competition if it's within the same bacterial population, or interspecific if it's between different bacterial populations. Fantastic. So yeah, great. Again, little minor things like that. You can even talk about the fact that there's not an initial increase until around 2 hours. Again, populations need time to start to reproduce and replicate by binary fission. So that's why there's not an immediate increase. You starting off with zero bacteria, it's going to take time for it to even reach anywhere near the number of, a million bacteria. Perfect. So yeah, only a few minor things to add, but Zach, overall, that was a great answer. So thank you very much. And thank you, Javin, for that answer. If anyone has any questions, then please pop your hand in the chat. So Zach, do they want you to keep generally what they'll be looking at? So the question is, do they basically want you to have like A level or like more simple knowledge? Generally the most important thing is going to be the structure of how you've answered it. So as you kind of describe it well. For the explanation, they would expect a little bit of bio knowledge. Like obviously, they're hoping all of you guys have all done well in your GCSEs because Birmingham are quite tough on that. Yeah, bio knowledge will be expected, but nothing too major. Don't worry. If you're a gap year student and you've not touched bio in a while, don't worry. It won't be it won't be too serious. Just a little bit of bio knowledge can help you stand out. That's all. Any other questions, guys? Pop them in the chat. But we will do a little Q&A before we finish up. Okay, the next question we're going to do. Oh, is ethics. So Birmingham tend to do role plays, but ethics is just as likely to come up. And just remember, your role plays will be an 8-minute role play. So the ones that where Amira we talked about before in terms of the interview structure, normally they split it into two separate stations. Like each station which is 8 minutes, tends to be 2 4-minute stations. Like one will be manual dexterity, one will be creativity. The role play will be a full 8 minutes. So do try and practice a longer role play. I know that's tough because most people tend to have 5 minutes, but just have a practice at around if 7 minutes is fine, but 8 minutes will be the total time. couple of minutes to have a think. And this one we can have as many people as you guys want. Just throw some ideas out there, what things to talk about. Perfect. That's a great start. Thank you. So we'll start off definitely with empathy and compassion. Perfect. So a big thing is not, and I say I harp on about this to my group. They've heard it so many times. Not what you say, but it's also just it's how you say it. So fantastic. It's going to be in a non-confrontational way if you do deem it appropriate to actually deal with the bully. I'll give you guys another minute and then we'll. It's more likely to. So this is ethics, Zach. But it's more likely to be ethics, but it could also be a role play as well. So I'm just doing the chat function and then Amir can ask people to speak if they want to. So for iPhone one, perfect. So make sure your friend knows you're always there for them. So this needs to be said kind of almost throughout, so at least at the beginning and at least at the end. Always follow up with your friend, and make sure that they know that you're always there for them no matter what. Perfect. And yeah, as you said, one-to-one conversation with the friend, open-ended questions, actively listening to their concerns, and that also needs to be done in a private space. You're not just going to do it in the middle of the canteen, for example. Maybe take them to a place that they feel most comfortable. But perfect, yeah, one-to-one conversation and private conversation. Um, People can carry on adding in the chat, but Amira, do you want to see if anyone wants to have a go?
As in for the mark scheme. I think just because we're aware of time, we could probably go
Anyone
through.
want to answer anything else? Like, does anyone have anything else to say? Someone want to, does anyone want to have a go? Again, the chat function, you guys are doing great on the chat. If anyone has anything else they want to just either full answer or just part of the answer.
Have a support system, yeah, definitely. Um, yeah, counselor, yeah, if that's something potentially you could say to your friend, if that's something they'd be willing to go down. Yeah, definitely. I'll go through the mark scheme now. So could talk to a teacher. Yeah, definitely. As long as they're getting the support they need, that's the main thing. Making sure that you follow them up after. But yeah, all the things you guys have been talking about. So definitely, talking to them in private, one to one, away from other people. Obviously, making sure that maybe you do it in a place that they feel comfortable. Maybe is there a specific cafe that you could go to? Because it's more likely that they'll open up to you there. It could be quite sensitive information, so make sure that you do respect that. Be as approachable as you can. Like you guys have been talking about, be that support system for this friend throughout. Um, and your friend, maybe, with the bullying, you're not aware what it is, but there could be a potential stigma surrounding their struggle. So, you want to explain that you're going to be there for them. Make sure if it's something maybe you can educate yourself on that thing, and tell your friend that you're not going to judge them, like we talked about, being non-judgmental, asking open-ended questions to them, finding out maybe some more information about what's going on so that you can support them better. Yeah, making sure that you're there to help them and guide them throughout this situation. And it's important to know, obviously, in this situation, you are the friend. Making sure that you do acknowledge that, and you're not a professional. So potentially, if, like you've been talking about, counselors, teachers, maybe like GPs, that's things that you can refer your friend onto, maybe if it's impacting their mental health in a negative way. So definitely something to note there. But also making sure once your friend has disclosed this information to you, taking into account autonomy, does your friend actually want you to disclose this information with other people? Make sure that you do obviously keep it confidential if that's not the case. And letting your friend know that you will not share that information outside. Talking, offering your support, your advice, speaking in a caring, empathetic way, like someone said at the start. And maybe another thing you guys could note here is the fact that your friend might not really want to talk to you. They may have a really negative reaction. They could be super angry or maybe even sad. And maybe you have to obviously be you in the situation have to be that friend to let them feel ready to talk to you about it if that's the case. So constantly reassuring them that you're there for them. Yeah, acknowledging their emotions, making sure that you're saying that you'll deal with it together. And always the last thing to hear is following them up, making sure that you check up on your friend after this situation, after your conversation, in order to help them in the future. Okay. Zach, I don't know, would you deal with the bully on your own or does it depend on the situation? So as in, would you approach them on your own? Probably if they're your close friend. And like I say, if you do feel the need to, maybe their mental health is quite poor and you think that this should be potentially, like we talked about, go to maybe teachers or GP, etc., then that's something you could maybe encourage your friend to do. You wouldn't want to force them to. You could just politely, maybe say that have you maybe got any help for this? And they might say, yeah, I need.
Asking Amira, would you deal with the bully? Like,
Hmm?
would you speak to the bully? He's saying, would you speak to the exact saying, would you speak to the
Sorry.
bully?
Um, I don't know. What would you say? Would you speak to the bully? Probably.
Generally, it depends on the situation. So in a situation like this, it's more than likely you're going to be at school. It's unlikely depending on the level of bullying, obviously there's different types of bullying as well. If the most important thing to say is if confronting the bully would make the situation worse for your friend, then I wouldn't do that. And instead, getting external help would be more suitable in that situation because often having approaching the bully is probably just going to escalate the situation. So it does depend on the scale of bullying. Generally, you're again, it's saying you, so you're an 18-year-old, having someone else to get involved and help is probably going to be more suitable. So generally, I'd say probably not. I'd say if appropriate, it's better to bring somebody else in, unless you and your friend truly believe you can help, you can get it sorted between the three of you. Um, and in terms of obviously the autonomy side of things, obviously if it's important to acknowledge your friend wanting to keep something confidential. If first of all you feel your friend is in any significant danger, then 100% you can, or harm, then you can definitely break that confidentiality. The other thing is encouraging a friend to open up and speak to someone about it is the most important thing. Don't try not to keep it just the two of you. Speak to someone about it to get it resolved. Okay. Can practice this in their own time. So the pros and cons of dentistry. So again, they tend to ask this kind of question in the more ethics scenario. Sorry, what ethics? In the more creative scenario. So like pros and cons of dentistry. What are the challenges of dentistry? So have a practice of that. I think you guys might have done that already in your group sessions, but do try and practice the pros and cons of dentistry as well. And as we said last time, I'm sure your group tutors have already said it, if you bring up a con of dentistry, make sure you spin it on its head and make it positive. So whether it's talking about backache and you bring in loops or anything to that effect, make sure you spin that con on its head to make it more positive. But just for the last few minutes, we'll just open up the floor. If any of you guys have any questions, to ask them now. Obviously, we were both at Birmingham, we both done the interviews. So any questions that anyone has about anything dentistry related? Practicing for the manual dexterity stations. So if you guys have heard of Blackstone tutors, they have some good manual dexterity stations to practice. You can use them. Even small things like just using if you have chopsticks, picking up certain objects with your chopsticks, little things like that to help practice manual dexterity station. Origami, and another thing to practice is maybe try and speak whilst also doing it. So there's two different things. Try and first of all practice your manual dexterity station whilst verbally explaining what you're doing. Like for example, origami, now I'm going to fold the piece of paper in half and create a triangle, whatever it is. The other way you should speak out loud is try and practice answering why dentistry and why Birmingham at the same time as doing your manual dexterity station, because like doing multiple things at the same time can be quite challenging. Um, to practice manual dexterity stations and look online, like I said, for some of the example stations. Generally Birmingham are more tuned towards NHS side. So London's a bit different. Birmingham, I'd say try and stick to the NHS, but you can always mention private if applicable. Amira, do you agree?
Yeah. Do they ask one question per station or multiple questions? It completely depends on the station. Like I said at the start, they usually do split it in half. So for some of the stations, and you'll have to answer completely different questions potentially. So yeah, that's completely dependent on the station.
You can
And
list your
then
interview if you want, other multiple questions here if you'd like to as well. Go on, sorry.
so for data interpretation, if you can find a link to dentistry from the data, could you mention it? Yeah, definitely. They might give a very dentistry related data interpretation question, in which case definitely bringing in wider dental knowledge would be really good for that. Definitely. What's the best way to revise? Because I got but and you know what's going to come up. Yeah, so I would say trying to focus on those type of questions that we've gone over. Like we said, Birmingham is quite difficult to revise for just because some of the questions are like the puzzle questions, you quite literally can't revise for them. But trying to put yourself in situations under pressure. So, for example, like the manual dexterity stations, maybe have a friend or family firing questions at you at the same time as doing that, just to keep you prepared for those type of scenarios. But yeah. God, do you want
Practicing from your Google Docs, like go through, make sure everyone goes through the slides that you've been through with your tutors for the group sessions. But yeah, like Amira said, I think it's Birmingham is very much about mentally preparing for these stations and these questions. Like they might get you to build something. These are kind of things that you can't really prepare for. Look online for some kind of maybe fun riddles, or like even like Towers of Hanoi, I think has been asked, previously at other universities. Like some fun puzzles. Um, whilst alongside I know it's tough, but it's the reflections on work experience, etc. So it's just in these next 2 weeks, make sure you guys all just keep on top of some of it and just mentally prepare for some of the more challenging questions so that you don't get put off when you do see them, which is probably the thing that most people do when they first see those questions. Do not no Birmingham don't see your personal, though they won't bring up your personal statement. Obviously know it yourself, but don't worry about that too much. You don't get pen and paper, so you can't take any notes in, and that's assuming they're keeping it the same as previous years. You only have 2 minutes to read the thing in front of you, but nothing to write down. Oh, Mohammed just asked Ojas about the session. It is being recorded, but just double check that with Ojas or your tutor. Okay, I think that's everyone's questions. Have I missed any, Mira?
No, I think that's all of them.
Perfect. Fantastic. So if I stop sharing the screen. Well done, guys. I mean, fantastic that you guys, anyway, congratulations on your interviews for Birmingham. Obviously, you guys, if you have any one-to-ones, Amir and I are more than happy to take them, or you've got your own tutors with OJAS, then make sure you make the most of those as well. So that's it for today. Hopefully, you guys found that useful, and best of luck for your Birmingham interviews. Um, Hopefully, Amir and I will see you at Birmingham in the next year or so.
Okay,
No
thanks,
worries.
guys.
Bye. Bye.
Well, thank you.
Thank you. Do you guys have any questions, or is it Mira left to end the meeting?
Yeah, do you want to maybe?
Well, if you guys can't hear us, then that's the end of the session today. Yeah, I'm gonna end the meeting now. Thanks, everybody. Good luck for your interviews.